Hey everyone, welcome to the Wilderness Reboot podcast. Again, Wilderness Reboot is a transitional support community exclusively designed for wilderness therapy alumni students. We're so excited to have Daley on today, an amazing guest who has a lot of hats. He was the co-founder of, Legacy Outdoor Adventures, Juniper Canyon Recovery Center for Women, marketing chair on the Outdoor Behavioral Healthcare Council. He's worked in a lot of other wilderness programs early on, and he's got a great story. Did I get all that?
Yeah, that's great. Yeah, thanks, Mark. That's good. Yeah.
Cool, man. Well, we're so excited to have you on and just hear your story, how you got into this field. It sounds like you've been in it for quite a while, and definitely, having a voice to educate the public about getting off the couch and taking treatment outdoors. It's been really cool listening to a lot of your stuff out there. So, if you don't mind, maybe you can start by telling us how you got into wilderness therapy.
Yeah, sure. Story is funny. I was just at a conference at IECA, and I got to sit around a fire with a group of people and share a little bit of my story and hear theirs, and it's a great way to connect with people, is to just sit and share our stories. So, yeah, thank you. There's like more than one story, right? That I think that we can tell why we do what we do, or how I end up here. But yeah, I found these fires out in the Well, I'll start by saying, I was 20 years old, and I was working for a professional employer organization. I was wearing a tie every day for like 4 years. And I just had this vision of myself, like, at the age that I am now, wearing like the same ties, and it just didn't have the soul. It didn't have the purpose and the meaning. And so I was hungry for purpose and meaning, and I was going through my young adulthood and having my own struggles, and I answered an ad in the paper, which was to go be a wilderness field guide. And I remember I was out on the training, and for the first time, I had the experience of sitting around these fires in the desert. And the experience that I had was profound. And what I found was people sitting around these fires and having these life changing experiences. I had this overwhelming feeling of connecting with my people, and there was just this magic that was occurring out there that grabbed a hold of me and has since become a purpose for me. And so I've spent the last 20 years since that first time finding as many ways as I can to sort of capture that fire or that magic and share it with as many people as I possibly can. And so, I get to go about that in a few different ways. And the Loa Fund is one, helping provide clients who otherwise wouldn't have the opportunity to go and sit around those fires, people from our own community. And that's been rewarding. And then, of course, with Legacy Outdoor Adventures and Juniper Canyon Recovery. So that's sort of a brief version to how I got into this work.
Wow. Yeah, there's a lot we can talk about. As you know, like this stuff you could talk about forever once you really get into it. And I'm excited to kind of dive into it. And so, you know, you mentioned the word magic. And so, in your words, if you were to try to bring yourself back to those moments back out in the field, what were some things that come to your mind when you connect that word magic to wilderness therapy?
Well, I think that through the power of relationships and wilderness, we discover the fire within. That comes to mind, right? That was an old mission statement of a program, and that really resonates with me. What I found sitting around those fires is, at that time, part of my identity, like I mentioned, was wearing a tie. I was an athlete. I had these various identities. And even though, as I sat around that fire, I didn't necessarily felt like I fit. What happened was I built these real connections through being vulnerable, through sharing life experience that was not something that I had participated in before. And so one of the things that stands out is just the ability that nature has, that adventure has, that getting outside and participating in these types of experiences have on our ability to build connection with each other. One of my favorite studies that I often talk about and quote is, they did a study and they took people into nature and facilitated these nature experiences. And one of the things that they found is it increased their compassion for themselves, for other people, and it increased their caring, their overall caring of the earth. And I thought, like, that, what better thing can we be doing right now for our children and for our communities than connecting people with experiences that are going to increase their compassion, their empathy for themselves and other people. And so I think that that's one of the things, and I see it play out in real time. I get to go out and spend some time with our clients on adventure, and I get to talk with them before they come in and hear their stories. And then you just, for years and years, you get to watch these transformations. One of the things that always stands out, anybody who does this work, is you've got the family workshop piece, and the families will come out and they're going to spend 48 hours, 2 days, maybe 3 days. And even in that amount of time, they leave with these profound experiences. And so it's not really complicated stuff. If you just take people with anxiety, mental health, depression, whatever's going on, and you immerse them in some adventure or nature activity. And what we see time and time again is that it has a profound effect on those things. And that's one of the things I'm really excited about, is finding ways. And I'm lucky in what I get to do now is I get to travel around and I get to find creative ways and going into different communities and cities and trying to connect with practitioners and referral sources and programs, and try to help them work with their clients to increase the dosage of nature, right? To be able to identify, I think that's one of the things we should be assessing in our clinical work. One of the questions we should be asking with all the clients we're working with is, how much time are you spending under the sun? In a given week, how many walks are you going on? That should be part of standard assessment, I believe. And then if we make that a therapeutic goal, and I'm talking about clients wherever they're at, not just legacy. If we make it a therapeutic goal for them to increase their dosage, we're going to see some of the positive effects that come from that. And I could talk more about that. Dr. Talbot and I co-created a nature connectedness typology, a scale, a way that practitioners can easily sort of assess practice where clients are at. And that's been a lot of fun. We've been able to sort of travel around and share that and really encourage. We talk about taking therapy.
And would that be?
Go ahead.
Oh, sorry. And would that be for utilizing for other cleanicians, outpatient, or other programs?
Correct.
You mentioned.
Yeah, it sort of came out of, a few years ago, ABC for Good, is like a local news program, was doing some stuff on brain. They were doing a program, a news segment on Dr. David Strayer at the University of Utah was doing some studies on how our brain changes in nature. And they came down and did an interview with me and talked, because we're sort of real immersive on that. And one of the things that I said in the interview, right at the very end, they said, "Is there anything else you want to add?" And I sort of spitefully said, yes, the question we should be asking is not, why does wilderness therapy work, but rather, why are we still doing therapy on a couch? And I just sort of switched the question on them. And of course, I didn't think they were going to use it. And then they lead with this on the news, right? And so suddenly I've got some of my best friends who are private practice clinicians. They're calling me and saying, "Hey, I know why we do therapy on a couch," and they're defending, doing therapy traditionally in an office, which was great, because I just wanted to change the conversation. I mean, part of what we're talking about is, does the environment matter, for the health? And so even if you're facilitating therapy in a traditional environment, which I think is totally fine, by the way, but one part of that we can bring into is that nature relationship assessment. And I think that it's fundamental. I think that it's that important that it should be part of every clinician's assessment, and it should be a therapeutic goal that we're working with our clients to increase. That's how important I feel it is. And And I think that what we're seeing over the last 5 years, for example, we are seeing study after study coming from around the globe that continues to validate the importance of getting some fresh air and just getting outside. There's many ways we can do it, but it's important.
Yeah, no, I love what you said. A lot of stuff I love that you said, and I think that question that's being reframed is, in some sense, deeply epistemological because it's basically, you know, I think a lot of folks would say that, oh, I'm not a nature person. I don't like getting outside, but we come from nature. And granted, I went to like a environmental liberal arts school and everything was framed from how we draw all everything we know from nature, from math, science, the arts, music, everything. And so um, those connections you talk about, yeah, like in outdoor education, you learn about understanding like connection with the environment, connections with others, and understanding a deeper connection with yourself, and fostering compassion, fostering stewardship, which is a big theme in environmentalism and outdoor education and being an outdoor educator. That's really cool. Do you, so cool. There's so many directions I think we can go here. What right now with what you're doing with Legacy and Juniper Canyon, from what I was learning about the programs, and maybe you could speak a little bit more to it, that it's a dual diagnosis approach. You guys actually also accept insurance, which is unique. Maybe you could talk about what makes your program a little bit more unique than others.
Yeah. I'll start with Legacy and Juniper Canyon. I mean, 10 years ago, we just celebrated 10 years last year. We're gonna have a celebration, 10-year celebration at NatSap coming up. I got to collaborate with when we were starting Legacy and the partners. One of the things that we wanted to do is first we wanted to utilize the adventure and the wilderness piece that we were all so passionate about. But then we wanted to have a really strong clinical piece, and we wanted to make it accessible. So one, we just work with adults. We're adult programs. So we got a Legacy Outdoor Adventures is for males, and then Juniper Canyon Recovery is for women. But what we did is we went about getting licensed as a residential treatment center. So we're licensed by the state as a residential treatment center. We have a couple of lodges just outside of Capitol Reef National Park where the clients come every week and they spend 3 days doing some of the more therapeutic parts of the program, meeting with their therapist, doing groups. And that allowed us to be able to pre-authorize and bill insurance. And so we were able to increase access. One of the things that I sort of discovered along the way, because as we went through this process, we're wilderness guys at heart, and we thought, how is this going to compromise the experience by having this lodge and not being full immersion? And I remember having different conversations with folks as I watched sort of our program in action. And what I found is that I think it actually has added to the clinical effectiveness. And one of the reasons I think that is in order for us to internalize an experience, right? There's a couple things that have to happen and for us to really be able to draw for anyone, right? And a couple of those things are having a good setup. So being able to go into something with some planning, some intention. What are we going to do? Why are we going to do it? Right? That's an important piece. Then you have the facility. You're setting goals.
Yeah.
You're setting intentions. Then you go out and you facilitate that adventure, that experience, and you try to return to those goals. And so that you're revisiting, like, why are we out here? What are we doing? What's the purpose? And then you have the debrief, right? Where we talk about what was that experience? What made it? What did we learn from it? How can we adjust? And by having these weekly breaks, each client has a role and they play a part in planning and executing each adventure. So they're a part of all of it. By having that built into the program, these breaks where we can process and debrief, I think it's added to sort of their ownership throughout the process. And these guys are learning how to plan and execute real adventure. And we see a lot of our clients going on to incorporate this into their daily life, right? Or into their life after they actually go backpacking or do these things. And so I think that that's one of the things that's made it effective. But you know, things that I would want
Yeah.
folks to take away is that we are adult, gender specific, and we accept insurance. It's very unique. Thanks for asking,
Yeah,
Mark.
it's very
I go,
unique.
I
It's
go
really
on these
cool.
long
And
tangents, so
yeah, say again.
I go on these long tangents. So sorry about that.
No. Oh, I love the tangents. No, yeah, I get lost out in that world too. So, okay, so we were mentioning about being intentional, having these goals, and then debriefing, which I think is for folks who don't know so much about outdoor education and facilitation, that perhaps comes from instructor perspective, from maybe Outward Bound, from its origins, and maybe even before that. That kind of reminds me of the nomenclature of the experiential learning cycle. And so I think helping folks be educated about some of the systems and theories and modalities in this work. Like we have the AEE, the Association for Experiential Education, and then also the Outdoor Behavioral Health Council, which helps accredited programs to have standardizations. And I think a lot of folks in the public perhaps have maybe a perspective that we're just going in the woods and we're breaking kids down and building them back up. And so maybe you could explain a little bit about maybe the accreditation process and the standardization of wilderness programs.
Yeah. There's a lot of misconceptions, and I love what Will White says. We know we've been able to present together and go around and try to demystify wilderness therapy, because there is a lot of sometimes assumptions that coming back that come to mind when people think about wilderness therapy. But the Outdoor Behavioral Healthcare Council, I mean, it's a group of leading practitioner and programs that have come together to really try to elevate. And I believe it was 1995, following some incidences, that some leading programs came together and said, hey, we need a way to elevate the field, to hold each other accountable. And they came together, they established some best practices. They actually worked with the state here to create some of the first regulations that come from the state. That was a mutually sort of collaborative process, which has helped sort of hold the standard. And I think that that's helped. Yeah, so occasionally I'll get a phone call from somebody looking for treatment for an adolescent, and the first thing that I always say is like, "Hey, the first place you go to vet a good program, are they OBH accredited? This is one way you have
Yeah.
to be able to quickly assess, are they meeting the standards of safety, of outcomes? Are they tracking what they're doing? And if they're OBH accredited, that they're following the best practices. I've been able to be a part of some of the site visits to be on an accreditation team. We have AEE people and university students and people from the council that get to go around on site, and actually we go through all of their policies and procedures. We go visit the groups, we interview clients and staff to make sure they're meeting that
Yeah.
standard. And I can tell you from experience that process, I mean, it occurs over a number of days, and people rarely hit it the first go around. Most of the time, we're coming back and saying, "Hey, here's some
Yeah,
adjustments
it's lengthy.
that you have to make to meet that standard." And so, yeah, it's not necessarily an easy process, but I think that it's one that elevates the field for sure.
Yeah, I think that's really good to mention because yeah, like going to school and understanding from instructor lens, getting to guiding, like setting up a quality adventure programming with understanding like your localized operating procedures, your standard operating procedures. There's so much that goes into proper safety planning and trip planning, site inspection, site management, and that's not static. And even seeing that standardization or that process of being accredited. I was down in Pure Life when Andrew was getting his program accredited, and I'm still learning about everything involved because there's like 200 something standards, and it's really involved from everything in their leadership team about best practices and safety planning to even making the facilitators of the groups and the instructors, which is where I can see the value of it, being experiential and having icebreakers and activities that are framed and trying to create lesson plans and programs that are therapeutic, in conjunction with the clinical team. And it's very involved. It's super involved. And I think it's more than just being in the woods or being out in the desert or being out being out in the backcountry, it's very intentional.
Oh yeah, well, I mean,
Really like what you said there.
one of the things I always tell field guides or new field guides and aspiring field guides or people who do this work is there's very few, I think, jobs that people can do that prepare them for life like the job of being a field guide. The skill sets that you develop working as an outdoor behavioral health care field guide are going to translate into almost any field or work that you could do in the future. They're going to give you some skills that are so valuable, communication skills and the ability to build relationship and handle conflict and navigate challenging circumstances. It just really, I think, so many of our field guides go on to do other things and they come back and visit and they talk about how being a field guide inform whether they're being a teacher or whatever, they can really draw from this experience. So it's pretty, and field guides are my favorite people. That's, that's part of my identity.
Yeah.
It's part of my identity I'm a field
Right.
guide in heart. That's who I am.
Fun crowd.
Yeah.
Very adventure loving, free spirited individuals, very compassionate, caring, a lot of things. Yeah. And yeah, that role is very foundational in leadership that, yeah, will stem into a lot of areas. And I think that's the same effect it has on the participants in these groups, and helping folks as a guide in these programs and students, have competency, that self-efficacy, which is kind of that model there with these attainable challenges that you're helping process. It's really awesome to help see the values within themselves come up in leadership. That's why I love outdoor leadership, because you see the decisions you make as a leader based on what your core values are. And so everyone has a different leadership style depending on that. And it's really cool seeing that uniqueness when you kind of can pull it out and see more of it within your students. It's a beautiful thing to witness. It's really cool. So tell us about kind of what you're doing with your alumni, because I find that really interesting. We're trying to support alumni over here, and you guys have been doing an amazing job over there. You guys have Cityscape with Legacy and a lot of other outreach. And yeah, tell us what you're kind of doing, because I think it's cool for folks to hear about.
Yeah, we have some folks on Russell and Jess, and then who are spearheading a lot of our adventure experience. We have one coming up in a few weeks where we're going to be doing a ski weekend and inviting alumni in. We just did one out in San Diego, a surfing one, and we've got Trey, who does outreach and Cityscape in sort of California, and Daniel in New York, who will facilitate and organize some adventure and places for alumni to connect there. But yeah, I mean, we want to create those spaces for people to get back in touch with the profound experiences that they have in wilderness and make it easy for them to sort of get back into that experience wherever they may be. And so we're limited a little bit with where we go, but trying to create these experiences where, like out in San Diego, we camped on the beach, had fire, we had discussion, we had reflection exercises, we did yoga, we did mindfulness practices, and we did adventure. And it was just such a reminder of how in such a brief period of time, like even for myself, right? I've been doing this for 20 years and I come away from that experience being like, oh, this is meaningful and this is profound and it's good for me. So yeah, we're trying to increase. We've been around 10 years. Of course, we've got alumni all over the place and creating more opportunity. Of course, we have alumni often come back and do a volunteer week, things like that. But oftentimes they're looking for more. So that's what we're doing. I love what you're doing, and I know it's such a challenge, right? It's such a challenge to just to try to create these spaces. But I see how hard you're grinding and the work that you're putting in to create these spaces. And it's one of the reasons why I wanted to talk with you, and was happy to talk with you to come on here to support what you're doing. And yeah, you got to come out to some of our alumni.
Yeah, no, I can't wait. It's going to be fun. And yeah, and that kind of brings up the idea of like what makes us so unique, this tribe, because when you connect with someone who's done wilderness therapy, you kind of just have a head nod, right? Like you understand some of the experiences they went through, and you have a different, rapport, different relationship that's kind of fast tracked. And that I think that's true for field staff or guides, and then also alumni as well, because it is a unique tribe and a unique experience, and it's not something everyone can really relate to. And I think that's like the ongoing joke with guides or professionals explain to friends and family what they do, and I think that shows up just the same for alumni. And I think it's cool to rally and bring that tribe together in a very uniform kind of way across the country. And so it would be exciting to see where that goes. And you've been so involved with this for so many years, and this is kind of like another question I was thinking to ask you is, where do you think the evolution of wilderness therapy is going, some trends, and where do you see it maybe getting more into the public? Like you mentioned, like just traditional therapy, getting off the couch, but do you see wilderness therapy being more utilized, like adventure therapy in outpatient practices with clinicians? Or, what are some things that are kind of interesting for you and seeing where this is going?
Yeah, I think that that is one area where we will continue to see some growth. I think that there's adventure works always comes to the top of my mind. Lynette Spencer, who started adventure work in DelCap County, just outside of Chicago, they're nonprofit, and they're really working with people who it's not your traditional wilderness therapy clients, right? These are lower income people who wouldn't traditionally have the means to access wilderness therapy like we're talking about it. And so they're doing things more locally and
Right.
creating access for people to have the kind of experiences canoeing and adventuring and doing things that they wouldn't otherwise. And I think that that's the way that I hope that we can continue to see the trends go, because I think that's what we need. Is we need more community based programs providing experiences for people to access earlier and earlier. And so I do think that Dr. or Richard Louv, who wrote the book Last Child in the Woods, he's a part of the Nature Connection network, and they had a conference in Oakland that Brett and I got to travel out to and present. And I was blown away it was a massive conference, and these were community practitioners. These were school teachers and public officials who came from all over to see how they can do things like improve access to parks and incorporate some of these ideas into the school systems. And so, it was kind of a look into a world that I don't often get to see. And I realized, like, oh, there's more going on, and there's more people sort of that understand what we do, I think, on a deep level, and are really working to expand that. So I think that what we will see is that, like, as things move on, that we'll start to collaborate more among these different sort of right now. I think that there's some silos of people who are sort of all just making the same discoveries, and I imagine that there'll be more and more collaboration among those, and we're starting to see it now.
Yeah, that's really exciting, because getting my hours over here in Massachusetts, in Springfield, the metropolitan area in Western Mass. I work in an integrated health clinic with a lot of low-income families in the DCF building, and we call it out here as a provider desert. And with the services that we provide, there's not a lot of community outreach. And there's the Wilderness School out there in Connecticut who kind of works in liaison with DCF and these kind of programs. But yeah, you're right. It's a different clientele in the more private pay wilderness therapy space, generally speaking. And that's what's cool that you're doing with the LOA Fund. We're trying to help give more access, and it'd be really cool to start seeing wilderness therapy and those outdoor modalities utilized in more cities. And yeah, I'd love to see more of that. It'd be really exciting. See where that goes. So with the LOA Fund, to kind of like wrap up, can you tell us about that? Because you hit some kind of exciting markers with just all the money you've raised, and I think that'd be awesome to share.
Yeah. I mean, it was the vision for the Low Fund started 20 years ago. As soon as I found it, I mean, one of the things that I realized early on after I had my first wilderness experiences, I went back to my home community, and it became pretty clear early on that this was not something that people from my community could access. And so that was the beginning of like, hey, I want to do something to make this more accessible for people, specifically from my home community. And it took a decade, but with my good friend Matt Poinsett, who's now a private practice psychologist in the Seattle area, we went to work and we started a Loa Fund with money out of our own pocket, and then to see where it's grown to now, it surpassed any sort of hope or expectation. You know, we do a fundraiser every year in my home community, and all those funds go to help people specifically from my home community. But we've been able to go far beyond that. And I think that you're doing crunching some numbers on the Loa Fund to see what kind of impact we have. And I think that we've surpassed $8 million in treatment services in the last 10 years. And a lot of that, I think, is part of program match, right? That's not all in money direct. It's programs are contributing as well in the form of discounts and matches and things like that. But we've helped people from all over the country, and it's not easy. You know, you raise money and then you give it away and then it's gone, and you're like, okay, we got to go raise more money. So the nonprofit, anybody who goes down the path of nonprofit and does that, I have a lot of respect for, because it is certainly a passion project. And I think that it's easy sometimes to be like, why are we doing this? Because it takes a lot of work. But it's been, for me personally, part of it for me is I had family members and friends who suffered from substance abuse, mental health, and addiction. And this was when I was a young field guy, and I wish that they all could have come out and been a part of what I was doing. And they didn't have that opportunity. And I want more people to be able to have that opportunity. And since then, I've actually been able to get some family members, my own family members, into programs like our own. And that's been really rewarding as well.
Derek Daley, making the world quite literally a better place. It's been really fun having you on. Just to end with one last question, what advice do you have for maybe folks considering wilderness therapy, or maybe alumni students, transitioning out of wilderness? Any advice?
Yeah, I would say that sometimes we get these really big, ambitious ideas around how we need to connect with nature. And one of the things that I often try to encourage people is sometimes just a simple walk, just going outside, just these little things that we can do, taking the dog for a walk, going out on your porch. We don't have to always plan a backpacking adventure or go surfing. There's really easy ways to bring the healing power of nature into our lives. And I would encourage people to start small and just try to make that a weekly routine.
Yeah. Love it. Love it. Love it. Love it. This was fun. Thanks so much, man. I hope you have a wonderful day, and everyone who's been listening, thanks so much for joining us today. And Derek Daley, it's been great.
Happy holidays. Thanks, Mark. Good luck with all this, and hope we can have some adventures together.
Yeah. Can't wait to talk again, and see you out in those alumni trips soon.
Thanks, Mark.
All right. Bye.